Hi guys, Chris Lendrum here from strengthphysio.com, and in today's quick conditions we're going to go through the triangular fibrocartilage injury. So, etiology and pathophysiology of this condition. So TFC, or the triangular fibrocartilage injury, is an injury to the ligamentous and cartilaginous structures that are attached to the distal radius, lunate, triquetrum, hamate and distal ulna. And this is usually associated with ulnar-sided wrist pain and clicking. It's often caused by falling onto the wrist or traumatic injuries to the wrist, and also sometimes there's just some general degeneration. So after we get to 30 years old, there's general wear and tear, and this over the years can then start to cause symptoms in some people. So the triangular fibrocartilage provides a gliding surface for the ulna, and it also cushions the forces between the ulnar and the carpal bones when moving. It's also an important attachment point for the extensor carpi ulnaris. Essentially, during axial forearm loading, it should take about 10 to 30% of pressure in the radius, in the TFC, and basically this can be increased if the radius, the ratio basically between the radius and the ulnar is reduced. So sometimes when people have fractures of the radius, that can cause an increase in pressure through the TFC, because there's a little bit of change in the biomechanics there. So potentially asking patients about their previous injuries, even if it's a long history or a long ago injury, is definitely relevant in these cases. So subjectively, they could have a history of obviously direct trauma to the wrist, falling on an outstretched hand, or also just repetitive trauma. So potentially if they're someone who plays racket sports or someone who's repetitively using their wrist. Generally it's going to be pain on the medial aspect of the wrist, which is better with rest and worse with activity on that ulnar side of the wrist. And obviously, as I said, look out for falling on the outstretched hand type injuries. Objectively, there's a painful grinding and clicking with range of movement testing, especially on supination, pronation and ulnar deviation. Be aware though that clicking is common in other wrist complaints. The lunotriquetral joint is often tender and unstable, but tender on palpation. And also the extensor carpi ulnari tendon can sublux and be tender as well. Also might find some myofascial trigger points and myogenic pain in the extensor carpi ulnaris and other wrist muscles. MRI for this is about 80% sensitive and 70% specific using a dedicated wrist coil. And MRA has been shown to be very accurate and less invasive, although the gold standard is arthroscopy. Obviously, as mentioned, this is more invasive. Differentially, we've got an extensor carpi ulnaris tendinopathy, rheumatoid arthritis or a carpal OA in that area of the hand, some wrist instability, and carpal fracture or ulnar styloid fracture, particularly if you're falling onto an outstretched hand. Also can have some carpal dislocation or subluxation, again more common, if you've got a traumatic cause to the injury. So management wise, we've got our normal price type treatment and NSAIDs for early stage for this sort of condition, potentially some immobilization with a splinting, and then following that with a graded range of motion stretching and strengthening program. Can consider taping, as I said, or splinting, which will offload that area. Avoiding the aggravating activities, particularly if this is something that's a repetitive strain type injury or repetitive trauma type injury to that area. And obviously, finally, if conservative management fails, then the patient may well need a surgical review. So that's our quick conditions review of the TFC or triangular fibrocartilage injury. Hopefully you really enjoyed it. If you did, please like and subscribe, and I will look forward to seeing you guys on the next video. Cheers guys.